Hello, I'm Heather and welcome to yet another episode of Life's On with Manipal Hospitals. Today we're here to talk about those two words that you never want to hear your doctor say, heart attack. Now we all know the signs and symptoms of a heart attack. There's pressure, tightness, an aching sensation in your arm and chest area, even lightheadedness. But did you know that it's possible to have a heart attack and not even know it? As Indians, we all have a genetic propensity for the disease, which is now the leading individual cause of disease burden in the country. Over the last 25 years alone, there has been an over 50% increase in the incidences of heart disease and stroke in India. To tell us a bit more about this today, we have with us Dr. Jyoti Kusnur, a consultant interventional cardiologist at Manipal Hospitals. She's here to tell us why we need to take heart disease more seriously, how seemingly fit people can suddenly drop dead from a cardiac arrest, and what we as a generation need to do to keep our heart healthy. Hello, doctor, and welcome to the show.
Yeah, good evening, Heather.
So, it's always a shock when we hear of seemingly healthy, normal individuals suddenly dropping dead from a cardiac arrest.
Yes.
So, what exactly is a heart attack?
Yes, Heather. It is very common, we commonly hear of some neighbor or some relative, who's apparently healthy, who was, always in the gym and, all of a sudden that person has suffered a heart attack and has died. So we keep hearing of this. It happens in our neighborhood, it happens in our workplace. So what exactly is a heart attack? Just like in your house or in your city, you have water pipes, supplying different parts of the city or different parts of the house. There'll be one water pipe going to the bathroom,
yes,
one going to the sink, one going to the wash basin. Similarly, our heart is, although the heart pumps blood to the entire body, it needs its own supply to sustain itself. Okay, just like a bank manager, he handles all the money, but
yes,
for him at the end of the month he needs his salary. So similarly in the heart there are three major arteries which are supplying different parts of the heart. So when any of these arteries, hartache shiro manta, hartache pipes manta, okay, any of these arteries get narrowed down. Okay, this narrowing is like corrosion happening within pipes. So when they get narrowed down, there can be slowing of flow. Okay, initially there is slowing of flow, but in a very narrow area, sometimes there is a clot which forms. Just like in a narrow road, एक vehicle सुद्धा accident करूंक शकता, मागीर full road block जाता. Yeah. So similarly in the heart, a similar mechanism happens when there is a heart attack. Suddenly there is a clot which comes into a narrow area which blocks the circulation beyond that, in the pipe beyond that area where it is blocked. So depends on which pipeline is blocked, depends on which part of the pipeline and which branch is blocked. We can have, it can either be a massive heart attack or it can be a minor heart attack. Just like if a major pipeline going to the city is blocked, the entire city does not receive, it does not receive water. But if it's only to a certain area, then only that area gets affected. A similar mechanism happens in the heart. So like how you said, silent heart attack, sometimes it is only a small area of the heart whose artery gets blocked, and at that time only that area, that part of the heart gets affected. The remaining part of the heart takes over the function. So the patient may not even know that that little pain that he suffered was actually a heart attack, or that little discomfort which he had 15 days back or 2 years back was actually a heart attack. But if it is in a major pipeline, okay, then it is almost always the patient would have symptoms. If it is in the main pipeline at the beginning of the main artery, then it can be a massive heart attack which can also cause a cardiac arrest, during which it's hardly those 3 or 4 minutes. If nobody is there to save the patient, then the patient can die.
So, doctor, what are the signs and symptoms to look out for?
Yeah, like how you have already elaborated, it's the most common symptoms are that constriction, pressure in the center of the chest. That's what patients usually tell us. Or it could be a sense of breathlessness. The pain can be going to both the arms, or sometimes it goes only to the left arm. Pain going up to the throat, up to the jaws, sometimes it goes like from the front it goes to the back, and some patients they present just like acidity. There are a lot of patients who get confused or who think that they have acidity, because the symptoms of acidity and the symptoms of a heart attack can overlap, and different patients have different sensitivities. They may not realize that what the pain that they are getting in the stomach or what they think is acidity and the discomfort is actually a heart attack. That is very bad, because it does not that patient does not present early enough for us to be able to save such patients. So even if there is some kind of acidity which makes somebody feel very uneasy associated with sweating, that person should go for evaluation. Let the doctor tell you that it is not cardiac. The patient should not decide for himself that this is only acidity, because that delay might cost him his life.
But is it necessary to have all of these symptoms to seek
Yeah,
help?
any of these symptoms, but the most classical would be pain in the center, what we call as retrosternal chest pain, behind the sternum, behind the breastbone. So that is the most classical. It is like a constricting. It's patients sangta ki kide ghat jata maka, and especially these symptoms are more when you are exerting. Okay, patients म्हणटा की बसल्यार म्हाका चड दुखना, बट हांव चलपाक सुरू जाता तेन्ना सामकें अशें घट धरता. Those are all typical symptoms of heart blockages, which can lead to a heart attack. Any pain which comes, which worsens when you try to exert.
Okay.
Okay, so any patient who says that I'm तशें बसल्यार काय ना, बट हांव जेन्ना हांव स्टेप्स चडपाक सुरू जाता न्ही, 5 दीस जाले म्हाका अशें कितें जाता म्हाका when I try to climb stairs. So these symptoms are very ominous. You have to come for cardiac evaluation. You need to meet a doctor when you have any such symptom.
So doctor, now suppose say a patient begins to feel such pain. Now what are the steps that a person is supposed to do if there's somebody that I'm with who is beginning to show signs and symptoms of say a heart attack? So what are the steps that we need to follow?
Yeah, the first thing is you need to take the patient to a place where a cardiogram can be taken. Okay, that should not be delayed. Okay. The ECG is going to tell us whether that particular pain is due to an attack or due to something else. So that is the most important thing. So what I suggest is if you are having such pain, or if you are sitting with your colleague or your neighbor or some family member is having such pain, do not waste time in some waiting room of your local doctor and all. Just go to a hospital casualty where an ECG can be immediately taken. There are patients who just wait in the waiting room of their general practitioners and all that.
Doctors.
Yeah, and not realizing that that waiting period is going to kill them. Okay, so go to a place where an ECG can immediately be taken, and on the ECG we know whether it is a heart attack or not a heart attack.
Okay.
So then we can start treatment early, and a lot of deaths can be prevented with early diagnosis of heart attacks.
Doctor, what if a patient is alone at home and it happens say in the middle of the night? Then what are you supposed to do?
Yeah, in such a case also I would say that immediately call for help. Make a phone call or call the ambulance. In Goa we have a facility, the government facility of 108 ambulance, which will always come in time, and there are paramedical people over there who can immediately resuscitate, and immediately they can tell you whether it's a heart attack or not a heart attack, and the patient will be taken to a place where further treatment can be given. So do not delay. I mean, many patients, they think, okay, it's now 12 o'clock in the night. Sagalyan kidyap disturb karu, rauta or sakalchi kidyap karu. Yeah, I'll wait till the morning. But that little delay is what kills patients. So when there is any symptom of a heart attack, do not delay. Ask for help. Call for the ambulance. Go to the nearest place where an ECG can be taken.
So doctor, you said that you need to go and get an electrocardiogram.
Yes.
What are the other tests that are involved to diagnose whether a patient is having heart attack?
These tests will happen in the hospital. If the ECG is normal, first thing that we do when a patient comes with chest pain is an ECG. If the ECG is normal, there are other blood tests that we do to know whether this is a heart attack or not. There are something called as cardiac enzymes. When the heart is injured,
even if there is no irregularity in the ECG.
Yeah, even if the ECG is, because there are different kinds of attack, and depends on which area of the heart is involved. The ECG may show different changes, depends on which artery is narrowed down. So we have these markers of cardiac injury, what we call as cardiac enzymes. So that level in the blood may rise. when there is a heart attack. So in case the ECG is normal, the doctor will take blood samples to check for these cardiac enzymes which are markers of cardiac injury.
Okay.
And if then that will also exclude any other cardiac. If we exclude any cardiac, we can do an echo, we can do an ECG and exclude that this is not a heart attack, then the patient can be investigated for other causes of chest pain, like whether it's acidity or some food pipe related pain or some pancreatic problem or some liver problem. All those can be investigated in the hospital, but the first step would always be an ECG.
So suppose your ECG comes back as you've had a heart attack, or your blood enzymes come back saying that you have indeed had a heart attack. What is the line of treatment involved?
As I told you, the heart attack is basically a clot sitting in a narrow area which is blocking the circulation beyond the clot. So there are two methods of treatment. The best treatment during a heart attack is a primary angioplasty. A primary angioplasty which we do in Manipal hospital, and there are a couple of other centers where it is done in Goa. So in a primary angioplasty, we go through the artery in the hand, the radial to the wrist, the radial artery, through a very, very small cannula. It's hardly a couple of millimeters. It's a very, very soft tube which enters the heart. It is done under local anesthesia. Then we check, we inject, we give an injection, we check exactly where the block is, where the clot is, and then we remove the clot and we widen that area by putting a stent. So that is a primary angioplasty.
This can all
that
be
is
done
the most,
through a little
through a little, it's not even a slit, it's just a cannula put through the right wrist. So it is a very safe procedure, and it is the best method to restore blood circulation. The earlier it is done, the better it is in patients with heart attacks. More muscle can be saved. So we always have this golden hour concept. The depends on how long the block has been present. Okay, more and more of the cells are going to die. Okay, so initially when the clot has just come up, okay, the cells beyond the clot are still alive. So if you are able to open up that clot and the block within the first few minutes, then you're as good as a person who has never had a heart attack. There is no residual damage. But with each passing minute, with each passing hour, more and more of the cells which are not receiving blood supply, they can keep on dying. So then opening up the artery a very long time after the attack may not have the same benefit as opening it up immediately. So primary angioplasty is the preferred and the best treatment in case of a heart attack. But this can only be carried out in a major center, like if you reach Manipal hospital or probably Goa Medical College, any of these major centers. Not everybody is able to reach these major centers in the initial immediately after a heart attack. Then the next option, which is carried out also in these primary health centers. Now fortunately the Goa government has these STEMI program, okay, wherein even this primary health centers, they can diagnose a heart attack, and that time a clot busting injection is given. That clot busting injection is going to remove the clot which is occluding, okay, but it is not going to remove the narrowing, it is not going to widen the artery, but it removes the clot, so some circulation is restored. Just like in a road which is narrow, okay, where something has happened and the road has narrowed down, then initially this flow slows down, and after that when there is a accident, the thing. So what the clot busting injection does is only to remove the vehicle which has got the accident, to restore the traffic flow. Okay, but primary angioplasty is also going to widen and make sure that no new clots form in the narrow area and no new attacks occur. So the clot busting injection is given initially so that the patient is stabilized enough to be able to be transported to a hospital where an angioplasty can be done.
Okay. Doctor, what about a bypass surgery? We hear of so many people that have undergone bypass surgeries. How are these different from, say, an angioplasty?
Yes, an angioplasty is a minimally invasive technique where, as I told you, it is just through the radial artery, through the wrist, where we put a small injection, and from that a small cannula which enters the heart, and through that we perform the angioplasty. So there is no cut on the patient as such. Okay, so it's like similar to road widening. The existing narrow road is widened. Okay, so then the flow is restored. But bypass surgery needs to be carried out in a few patients where road widening, where this angioplasty is not going to work. Okay, so in sometimes, as you know, in when the roads and all, when they are narrowed in multiple places, and there is absolutely no way that you can widen those roads. There are houses and there are shops and all, and you cannot displace them. So in that case, just like the government decides that I cannot widen this road, we shall create a totally new road. So they will bypass that route, and it's a surgical procedure. Fortunately, now with so much of development in angioplasty, our technologies, our stents, everything have improved so much that very few patients actually end up with bypass surgery. So out of every 10 people with heart attacks, maybe only 1 will require a bypass surgery. The other 9 will be manageable with angioplasty today, because of improvements in technology. And another very favorable government policy in the last couple of years was the stent pricing. So they have the government, the central government has capped the price of drug-eluting, the medicated stents, at some 30 odd thousand. Previously, some years ago, the stents were like like 1.5, 2 lakhs and all. So very few people could actually afford angioplasties, and when there were multiple blocks, they used to end up with bypass surgeries. But fortunately today that is not the case. Because of the stent price control, angioplasty has become a lot more affordable to cardiac patients, and many more people can benefit from angioplasty. So in the past, some years ago, they were forced to go for bypass surgeries, but now we can manage them with angioplasties, thanks to, there are favorable government policies, plus technology also has improved. We are able to cross more and more blocks with angioplasty.
Is it possible to survive a heart attack without going to a hospital?
Yes, as sometimes if you are lucky, but it's like if only a small artery, only a side branch is blocked, okay, the patient might be lucky enough to get away with that heart attack, without major damage. And maybe some years later, when he has gone for some other reason, ECG is taken, that time the doctor might tell him, yes, I think you suffered a heart attack some years ago, and that time the patient remembers, yes, some 6 years back, suddenly there was some chest pain, but after 2 days it went away. But those are those lucky patients, and that happens when it's a small area of the heart which is involved. It is very unlikely if a large area of the heart or large pipeline is blocked and still that patient survives. That is very rare. So my advice to patients is, when you suspect a heart attack, please make sure that you receive medical attention as early as possible, because early diagnosis, early treatment can save a lot of lives, which otherwise we are losing. So a lot of lives are lost because patients don't reach hospitals in time, or they ignore their initial symptoms. That is why deaths occur.
There are also a lot of forwards, on WhatsApp, saying that you need to cough hard and that would stop a heart attack. Is this true? Is there any truth?
I wouldn't say that is true, because first of all, it is very difficult for the patient to tell whether it is a heart attack or it is some other cause for his symptoms. So nothing should delay your visit to the hospital. That should not get delayed. Everything. So yes, we do make patients cough sometimes when their BP is dropping, but that is in our ICUs and all. That doesn't apply to the patient cannot decide for himself what he needs. That would be a dangerous thing.
Okay, doctor, what are the concerns for post-operative care? Say after a heart attack.
After a heart attack.
Not necessarily post-operative, but just even after a heart attack.
See, as far as the procedure goes, angioplasty and all, it's a very as far as the patient is concerned, it's a very simple procedure. There's no cut on his body. That recovery of the heart takes some time. If it is a major heart attack, if it was a large area of the heart which was involved, it can take a few days for recovery. In the initial days, that's when a patient of a heart attack comes, we usually caution the relatives that first 48 hours much critical asta, 72 hours much amka pong jai, because the heart can be irritable, just like any other injured part of the body gets swollen up. After injury, if you have injured your hand also, it gets swollen up. So similarly, the heart, when when the heart is traumatized, when it is injured, for a few days it can be swollen, it can misbehave, the electrical system will not work correctly when there is swelling and edema in the heart. So all these things can cause arrhythmias, what we call as instability, skip beats, the beats can be abnormal, the BP can go too high, it can go too low. All these things can happen in the initial days after a heart attack. So these things are best managed within the hospital, but most patients are who have been treated correctly should be able to go home within 3 to 4 days after a heart attack, after an angioplasty. And after that, the kind of care that is most important, that's what patients would like to know. They have to be careful about the diet, because we believe that, or it is known that narrowings in the arteries occur because of various factors. One thing is smoking. Smoking is entirely, I mean, it is in the patient's hands whether they want to smoke or not. So every cardiac patient is always encouraged to give up smoking. Smoking should be given up completely. If he or she was a smoker before, that should be given up completely. And what I would like to impress upon patients is that it takes almost 10 to 15 years for your body to recover from the effects of smoking. Okay, so it is that dangerous. The poison of smoking remains in the body for almost 10 years. There are patients who tell, na 4 दिसा पयली हांवें सोडले आनी आयज अटॅक जाले, ते कशे जाले? That is because that I mean, it takes that in 4 days is not the time that the body takes to recover from. If you are a smoker, it takes 10 years. The damage is already done. Whatever damage had to be done to the body is already done. So we always encourage patients to completely give up smoking. Then they need to watch their weight. Obesity or increased weight is not good for the heart. It can create blockages. It can put more stress on the heart. Then we always ask them to be on a low fat diet. म्हणजे butter, ghee, cheese आणि तळलेले सगळे fried items बी सामके कमी करूंक जाय. जितले कमी तितले बरे. Red meats we ask them to minimize in their diet. Egg yolk also is not very good for those people who have high cholesterol levels. So these are the dietary precautions. Yeah, and fish is good for the heart as long as you don't fry it. Boiled fish is good for the heart. Lots of vegetables we ask them to have. We tell them that the more colorful your plate is, the the healthier your body is going to be. So a lot of colored vegetables and fruits and vegetables that should be maximized in the food. Minimum fat and more of vegetables, more of fruits, fish they can have. So these are the dietary precautions. Then those people who have diabetes has to be kept under control because diabetes is also very corrosive. That high sugar levels are corrosive for the arteries, so they create narrowings, they create damage within the arteries, they promote blockages. So
doctor, we also hear a lot of people nowadays in their 30s simply dropping dead from a cardiac arrest. Is this due to stress? Is this due to lifestyle? At what age do we need to begin screening for heart disease?
Yes, that you're right. There are people in their 30s now. That is again because of lifestyle choices. Many of the younger people today are smokers. If you see these young executives and this people who work for these companies, private companies and all, in many of these big cities in India, you see a lot of them are addicted to smoking. So that is one major risk factor which is completely avoidable. Besides that, even our they don't sleep properly because of all these gadgets and all. They stay awake in the night. It's like till 12 o'clock, 1 o'clock, 2 o'clock, you're on Facebook, you're messaging your WhatsApp friends, and also these kind of alterations in your sleep-wake rhythm, they increase the stress hormones in the body. Alcohol also, all these, that also increases your stress hormones and can create stress to the heart. So, and lack of physical activity. Today, for everything, even if you want to go and, sedentary lifestyles, most of the time you spend in front of your laptop, your screens, or in front of the TV. Even if you want to, some 100 meters away, if there's a shop also, people prefer using their cars. And nowadays, they don't even use their cars. And if they want something to eat, they'll order on Swiggy and they'll order on, so everything Amazon brings your stuff home. So, I mean, physical activity is very much reduced. So, these things all contribute to younger people developing heart attacks.
As Indians, we are, already, we have a genetic propensity for heart disease.
That is true.
Are you seeing similar, is there a similar trend in Goa?
Definitely. We Indians we Asians, Indians, we have high levels of triglycerides. Even our food traditionally is, high carbohydrate diet, and also these are all, they promote diabetes, they promote this metabolic, what we call as metabolic syndromes, which can, create heart attacks.
Is it hereditary?
There is a hereditary component. Heart disease is multifactorial. Means there are multiple factors, as I told you, like smoking and diabetes and high blood pressure and lifestyle, sedentary lifestyle, putting on too much of weight. Similarly, hereditary component is also one of the components. So there are people who don't smoke, who don't drink, but who can still develop because their parents, their uncles, their aunts all have had heart attacks. So they also those people should be more careful, and they should be, like you asked, who has to go for screening. These are the people who should go for earlier screenings. Yeah.
So it is indeed shocking when we hear of people, you know, in their 30s suddenly dropping dead from a heart attack. Yes, as Indians, we may have a genetic propensity for the disease. So there are some things that we cannot control, true. But there are a lot of things that we can also do to reduce our risk. As doctor just told us, quit smoking, eat healthy, and definitely exercise more. I think that's all the time we have for today. Thank you so much, Dr. Jyoti, for joining us. And thank you everyone for tuning in. For now, this is Heather saying bye. You keep watching Prudent Media.